Today is September 24th. It is the date of FH Awareness Day. Every year in this date we talk to the people of Iraq about a fatal disease called familial hypercholesterolemia. This disease is an increase in blood cholesterol due to genetic reasons. It is not due to unhealthy diet or lack of physical exercise. A healthy subject is able to handle the increased amount of cholesterol in the body by certain mechanisms. These mechanisms are lacking in patients with familial hypercholesterolemia. It is a common disease in which one person is affected in every 250 persons worldwide. The problem of familial hypercholesterolemia is underdiagnosis and under-treatment. This disease, we detect only 10% of people affected, while 90% are still escaping the diagnosis. And unfortunately, even the 10% diagnosed of patients with familial hypercholesterolemia are poorly treated. In Iraq, we achieved the first step of controlling the impact of this disease by establishing a great network of specialized lipid clinics. Comprises till now 13 lipid clinics from the north of Iraq to the south. These specialized lipid clinics provide unique health care to patients with familial hypercholesterolemia in Iraq by well-trained physicians who are trained outside Iraq on the hands of experts very well known in the world. The function of, or the task of these lipid clinics is to early diagnose and properly treat these patients, because lack of early diagnosis would lead to increase in blood cholesterol, and this cholesterol will deposit in the blood vessels of the heart, kidneys and brain. Deposition will lead eventually to the narrowing and occlusion of these vessels. So early heart attack, kidney failure and stroke will be the very bad consequences these people will suffer from. So early diagnosis will lead to avoiding such fatal consequences. In order to control the impact of familial hypercholesterolemia in Iraq, we officially launched a program called the National Pediatric FH Screening Program in Iraq in 3 Iraqi cities. In Al Diwania, 180 kilometers to the south of the capital Baghdad, at Samawa, 270 kilometers to the south of the capital, and Erbil, the capital of Kurdistan territory, 360 kilometers to the north of the capital Baghdad. We targeted children starting from age 18 months old and above, especially those of consanguine parents, to diagnose them with this disease. If we diagnose these children early, we shall start supervising them properly and give the scientific treatment to avoid the horrible consequences of these diseases. Iraq now is the first country in the Middle East and North Africa which established this program in the country. We are planning to expand this program to include as much as area of Iraq once the health authority there controlled the pandemic of COVID-19. We encourage all parents to bring their babies, especially if they are relatives, to consult our pediatric lipid clinics in these cities and in every other city to check their LDL cholesterol, whether we have the signs of this disease or not, in order to help them to diagnose their children and to save their lives. To control the impact of familial hypercholesterolemia in Iraq, especially it is a fatal disease, and support for the medication provided for patients are lacking in Iraq. We designed a strategy, actually it is a preventive strategy called the premarital FH screening program in Iraq, in which we subject the couple planning to marry to measurement of LDL cholesterol to see whether they have an increased value or not, and then they consult the lipid clinic to see the opinion of the physician there to decide whether this increase in LDL cholesterol is genetic or secondary. If it is genetic, we shall inform the patients or the couples planning to marry that their engagement will lead to the birth of diseased children with a severe form of familial hypercholesterolemia, that is homozygous familial hypercholesterolemia. This disease has fatal consequences, and it lacks response to the available medication. So we shall give them options. One of them is to reconsider the marriage. The second option is to provide a prenatal testing to see whether the embryo is infected or not, so as to terminate pregnancy. The aim of this strategy is to prevent the birth of more cases of homozygous familial hypercholesterolemia. It is a preventive strategy. So it's my privilege and honor to announce the official launch and implementation of the premarital FH screening program in Iraq for the first time in the whole world in this date, September 24th of 2020. Some may ask why we are obligated to or advised to be subjected to measurement of LDL cholesterol prior to marriage, because it is for the welfare of the parents. The parents in Iraq, at least currently, they are responsible for providing the treatment for their diseased children. The health authority in Iraq currently is not supporting providing medication for patients with homozygous familial hypercholesterolemia. And indeed, it is not the problem in Iraq only, it is a problem of many countries. So we are advising the parents to bring their children to be subjected themselves prior to marriage for measurement of LDL cholesterol to help them to live a healthy life. Thank you very much.